Camera. So good afternoon to all of you. We'll have the three very eminent speakers in today's seminar session. Then if the time permits, we'll have some time for question answer. Most of the core faculty members have joined. We have Dr. Nand Kumar, you already know, he has given invited talk. Dr. S.K. Ghosh and myself, S.K. Mishra. Dr. Jay Kumar is joining from Nimhans, Bangalore. Then Dr. Kunal Sharma, he is also joining online from Delhi. So 5 faculty members have already joined and one more is likely to join. So the format of the seminar is already known. We normally allot around 15 minutes time for one speaker, but plus minus is okay with us. So the first speaker today is Dr. Bhamati Balsubramanian, and she has chosen a very, very important topic, that is gender perspective in CBRN. Now this topic is always important in case of any difficult situation, whether it is a conflict or disaster or emergency, natural or anything. So we welcome her. And sir, you want to say anything?
Please go ahead.
Okay. Anything want? Okay. So we welcome her and request her to begin the speech. Thank you.
A very good afternoon to all the faculty members and my co-panelists and other participants. And I thank HBNI for giving me this opportunity to make this presentation. I realize that I've chosen a topic which has not been covered in this course. So that was, therefore I felt it would be good to highlight these gender issues in CBRN because it's not so researched, it's not so much in discussion in public discourse in the context of CBRN. In natural disasters, it's picked up over a period of time. Therefore, I thought we will be able to take a look at it. The second, can you change the slide, please? Next slide. Next slide. Yeah. Now, the scope of the presentation covers gender in natural disasters and also gender in CBRN emergencies and disasters, including CBRN-enabled threats. The Sendai framework fundamentally recognizes that women and children are disproportionately affected by disasters. Now, there's no gainsaying that. This is now well documented. Although Sendai framework does not cover CBRN emergencies and disasters, this is a framework on which we build upon for CBRN also. And we are not looking at as a Sendai framework as something that is an overall coverage of gender issues in disasters in general in a generic way. The CBRN, therefore, we can conclude straight away before going into the presentation that CBRN disaster management is not gender neutral. Next slide. Next slide. Now, I will only highlight the fact that the difference between sex and gender is the fundamental to understanding, the sociological and the biological aspect of gender anywhere, wherever you want to apply it. So we call sex biological, that is something that is nature given, and social is social construct, how society constructs roles, functions, responsibilities, and all these, and it will also include the stereotypes. So one is nature made and the other is society made. The rest is not important, we'll move on. So these are the basic differences. I have highlighted 2 of them, which is relevant for this lecture, for this presentation. Next slide. Now, what is the framework to understand gender impact in natural and CBRN disasters? Are they convergent or divergent? Now, the basic point is when we were asked to present this impact gender issues with reference to CBRN, it's not possible to isolate one from the other. So they are not mutually exclusive. And for that, I'm giving this these the set of statements here. So, gender issues in natural disasters refer to the foundational impacts arising out of the differences that we have stated earlier, and that is how women and girls are differentially and more impacted than boys and girls, than men and boys, because of a combination of both biological and sociological vulnerabilities. Now, biological is not that there is some weakness. By having certain biological features, getting exposure causes certain biological vulnerability. So there is no inherent vulnerability as such, but the way it reacts to a situation, way it is exposed to a situation, that becomes a vulnerability. There will be therefore an overlap of impacts between natural and CBRN disasters, and therefore we cannot talk about CBRN disasters, gender issues in CBRN alone. That's not possible. One reason for this. But CBRN impacts has a special focus on, we can always say that there is a special focus on the differential health outcomes of men and women, with a special focus on reproductive health of women. This is the fundamental point when we are looking at CBRN disasters from the biological vulnerability point of view. Now, CBRN disasters can happen singly, or they could precede or succeed natural disasters, or vice versa. We have examples for that. So, keeping this in view, so you have multi-hazard, you have cascading disasters, you have multiple disasters. Therefore, CBRN disaster, DRR, when you look at disaster risk reduction in terms of gender, cannot be segregated or seen in isolation, and therefore we're looking at it as a package. So the biological, which is nature given, and sociological vulnerabilities, which is people made or man made, arising because of specific or limiting roles given by society to women. That's the latter part, sociological part, to women and men, more women than men, aspecting gender inequality. This is to be addressed in disaster risk reduction in CBRN. Next slide. Now, disasters do not discriminate. Yes, that's correct. But then people do while responding to disasters, and that is the crux of the issue. Existing gender-based socio-economic inequalities mean that disasters can lead to different outcomes. And one such strain is that women may face greater financial strain following any disaster, especially if they are primary caregivers. And now they are being looked at, as primary caregivers being because of their reproductive function, and their ability to work is compromised. This can exacerbate existing gender inequalities in employment and income. And research has time again revealed that disasters reinforce, perpetuate, and increase gender inequality, making bad situations worse for women. Gender inequality is one of the several underlying risk drivers increasing women's vulnerability to hazards. Therefore, when we do risk assessment, this is a very important point. What is it that drives vulnerability of women? And therefore, to unravel and uncover and manifest the risk drivers, underlying risk drivers, which are sociological, have to be kept in mind. And this is where we are looking at integration of gender into CBRN. The most dominant aspect of CBRN, I've just touched upon it, is in CBRN is the health impact. It entails higher social costs to society, primarily because of the biological concerns pertaining to the reproductive functions of women. Hence, CBRN impact in utero is uterus, leads to an intergenerational and multi-generational impact. Example, Bhopal gas tragedy. In fact, the first set of brilliant research on gender came about much after the Bhopal gas tragedy, and sometimes it's continuing even up to now. And there's something as late as 2023, which is brought out, and it's very, very what do you call it? It's a kind of a model for any research to follow. If we have to look at other aspects of CBRN, not just chemical but biological, radiological, and nuclear disasters. The social costs stemming from CBRN disasters extend far beyond mortality and morbidity experienced in the immediate or in the long-term aftermath. In natural disasters, for example, More women are represented in mortality than men. This is again proved. Look at tsunami. But in CBRN disasters, where male mortalities outnumber female mortalities, could potentially, given the gender-based preponderant workforce representation of males in chemical or nuclear facilities. This is specific to these two, not to biological, chemical or nuclear facilities. Next slide. Now the next slide, please. The impact of the sudden onset of chemical or nuclear accident on women can be very profound due to various factors related to gender roles. I'm going to come to that later. They bear the brunt of caregiving, we have said that, so they may be disproportionately affected by the need to care for sick family members. I'm coming to specificities. For sick family members, senior citizens, or children in the aftermath of such disasters. Gender inequalities in access to resources and decision making can further exacerbate the challenges women face in responding to and recovering from these events. The psychological effects, we'll come to that a little later. I'm looking at displacement and shelter. We'll come to that later. I'm just highlighting those issues which we will be elaborating upon. Access to information and decision making, socio-cultural norms, and healthcare access. Next slide. Next slide. Now, I'm giving certain citations and examples, say women and COVID. And this is pertaining to biological plus vulnerabilities. I'm not calling it biological alone because it's very difficult to separate biological from certain other plus factors. So women's biological differences makes them vulnerable to unique health issues that men just would not experience. As a result, the pandemic did not spare the sexual and reproductive health of women. We're looking at sexual and reproductive health. Pregnant women found to have more severe COVID-19 infections, increased hospitalizations, and intensive care unit admissions. There were more cesarean sections done among COVID-19 positive patients. One survey reported that more than 40% of the women reported changed their plans about when to have children or how many children to have because of the pandemic. And another 30% reported experience pandemic-related delays or cancellations for contraceptive care. Now, being part of the informal sector and care economy, more women were rendered unemployed during the COVID. This is again, there's full evidence to this. This is based on data. Women caregivers were more at risk of experiencing a specific stress called the caregiver burden, which is a toll that caregivers experience not only on their social or financial well-being, but also on their emotional and physical well-being. And we'll come to this mental health issues, which Dr. Jayakumar so brilliantly presented during his sessions. The concept of care economy and gender stereotyping does not restrict to family alone, that where the mothers, sisters, women as caregivers within a family, but into the larger society in the public domain, where nursing dominated by females is dominated. We know that 80 to 90% are women who suffer as a healthcare workers physically, emotionally, and mentally. Now, women experience this burden during a time when they were isolated and in need of social support networks. The isolation exacerbates the effects on women's mental and physical well-being. Now, women in COVID have dealt with biological vulnerabilities and because of socio-cultural constructs, certain added sociological vulnerabilities, and they cannot be separated. So I'm putting them together. So I'm showing the red in sociological and biological in blue. Next slide, last slide, please. Now, COVID vaccine, similar, they tend to have stronger side effects in women than men because of the estrogen in women's bodies is designed to elicit a stronger immune response. Evidence that females subjected to COVID-19 vaccines may experience menstrual abnormalities. This has come out in a very big researches of various stages or various forms of abnormalities have been discussed in research, and such abnormalities can impact daily life activities and ultimately impair the quality of life of women. Women had to still go into it because it was life-saving and it was the potential of the disease were far worse than the vaccination side effects. Next. So the Bhopal chemical disaster. This is precisely, I'm talking about the in utero aspect of reproductive health as it relates to biological vulnerabilities of CBRN. And in this case, we have taken the example of chemical disaster. The intergenerational, multi-generational, and long-term impact on children in utero, the toxic legacy, severe health impacts, both gynecological and reproductive health. I'm not going into details, but I'm looking at a research that has conclude these findings. Studies document a fourfold increase in the rate of miscarriage following the gas leak, as well as increased risk of stillbirth and neonatal mortality. And we are also talking about menstrual abnormalities. This has also been documented in the case of the chemical disasters also. And premature menopause have emerged as very common problems among women exposed and their female offspring. Now, sex ratios. Now, how many boys are born? Now, as it is, we have a very adverse sex ratio in the country. But what did the chemical disaster do? The Bhopal chemical disaster. It says women who lived within 100 kilometers of Bhopal experienced a relative decrease in the birth of males in the 1985 cohort, a sex ratio which is adverse to males. That is 64% of children born from 1981 to 1984 were males, a proportion that dropped to 60% post-disaster in 1985. Now, this is consistent with male fetuses being more affected. This is naturally given that there are wastage of male fetuses is more. And that's how you have sex equality in sex ratios, 1,000 is to 1,000. But because of feticide and infanticide, we have brought down the numbers from 1,000 to 990, 924, 927 for females for every 1,000. But the chemical disaster proved to be result in sex ratios adverse to males. And women living beyond 100 kilometers had no difference in the sex ratio across the 1981 to 84 and the 1985 cohorts. So we are linking, look at that, the basic biological and how it is having a sociological impact. It is disrupting the sex ratios. Now it should not be adverse to either, right? But it has become adverse to males in the context of the chemical disaster of Bhopal. Next. Next slide. Now, this is a very important aspect, is something that has not been touched ever so far. And it is the Johns Hopkins University and the Infant Feeding in Emergencies core group which got together, and that too in the context of the Ukraine war, the threat of chemical and biological warfare, that they came out with these guidelines last year, 2023. For each of the chemical agent, for each of the biological agent, for all for nuclear and radiation aspects, they worked out what is the antidote, when it is to be given, can they do breastfeeding during that period, and when it is not permitted to do. It is a very, very detailed guidance note that has been given, and it includes nuclear power plant emergency for the first 3 days after the emergency, right? This work was, as I said, it was, but it can be integrated into our disaster guidelines and policies for countries and NGOs around the world. And the most important part is, it was not isolated, it was not left to the doctors alone to do it. It was a multidisciplinary effort that resulted in this. And it's very important aspect to be addressed by the NDMA and other authorities, statutory and other bodies and administrative authorities, to look at these issues in the context of CBRN preparedness, infectious disease, disaster response, nuclear and spirits, amongst others. These were the experts who were part of this group. And it remains an evolving field, because nothing can be predicted, cast in stone. The evidence-based work is intended for policymakers, as I said, healthcare workers, emergency planners, and can be used alongside existing guidance for the general public and healthcare workers. Next. Next. Yeah. Now I'm giving certain citation examples on gender-based sociological vulnerabilities of women as applicable to CBRN. Now, when I say CBRN, it doesn't mean I'm looking at certain sociological issues and linking it to CBRN, but these could be very well applicable to, natural disasters also. So women are at a greater risk of injury. Now, injury is very important aspect in CBRN, and death due to societal restrictions and gender roles. Swimming, for example, is not a skill girls and women are encouraged to learn, and they lack life-saving skills such as swimming and climbing. In some regions, women's clothing limits their mobility. In some societies, cultures, women cannot respond to warnings to leave the house without a male companion or the children or elders. Loss of crops and livestock managed by women has a direct detriment to family food security. So the citation is more women die than men from natural disasters. That is given. The cattle care, whenever, and I remember Mr. Nandakumar's presentation, when he said that, the animal husbandry officer should be present there because these women will not leave their place. They're so attached to the cattle because it's a source of livelihood for them. And if they care there for them as much as their family members, it's a very important component of evacuation. Are we addressing that? In chemical and nuclear disasters, evacuation of women is much more challenging to NDRF and SDRF than in natural disasters, given gender roles. Next. Now we are looking at, and the first one was where there's a quick onset of disaster. We are saying fast ones. Now we have look at slow onset disasters like the COVID-19. Mental health issues for women during COVID. And I rely on Mr. Jayakumar's presentation for making a case of the 53.2 million cases of major depressive disorder. 35.5 million cases were of women, 17.7 million cases were of men during this period, during COVID. In the case of anxiety disorder, out of 76.2, 51.8 women, 24.4 men. So it shows that the grossly disproportionate impact on mental health of women. There are other issues. Domestic violence against women and girls, sexual abuse of girls at home, and marriage of minor girls to avoid costs of marriage and dowry rose multifold. The UN called it the shadow pandemic. Very excellent evidence and documentation available to prove this point. The cases of missing and trafficking of girls, this is an area I've been working on for the last 35 years, so I'm aware of what's happening here. For sexual exploitation, even during COVID, went up very high during this period. Evidence relied upon reports of the National Commission for Women and Child Rights Commission. Next. Now, I've just showed this in the pie chart, what this data about how it is higher. It's additional cases due to COVID-19. The increases were higher among females than males. So just the data has come in the form of a picture, right? Pictorial chart. Next. Now what happens? We all talk about early warnings in all the discussions during the second semester, even the first semester of HBI and of this course. We were talking about early warnings. How much of ICT in nuclear, in chemical disasters. Now we have to understand that warnings in many cases do not reach women. Mobile is a major issue. I'll come to that. I'll expatiate upon that a little later. But then, women lack adequate awareness as to how to act upon warnings. Now, they are not very visible in the run-up to the training, in the run-up of in the community. When you meet with the community, how much of women are you getting into the training programs? How much of awareness building is reaching them is something that we have to look at. Women tend to take the responsibility of carrying children elderly. We have said this. There's unequal access to finance, technology, knowledge, and mobility. Now, technology, unequal access to technology is something that I would like to emphasize, because all the discussions throughout the HPNI course has been about how we are, how better technology. But then we must be prepared for the digital divide. Hampers women's access to information, limits their ability to prepare and respond to disasters, and women suffer inequitable access to markets, credit, relief services, resulting in less ability to recover. Now, COVID-19 pandemic has exposed India's digital gender inequality. One of these is the digital gender gap, with only 1/3 of the women owning a mobile phone compared to 2/3 of men. The divide is far greater for poor rural women who are much less likely to have digital literacy skills. Now, during COVID, due to introduction, and these are nuclear facilities, as Mr. Nandakumar was saying, was all located in, say, far off in rural areas. And then, therefore, we have to look at what is the educational attainments of people living in these areas, particularly women. Now, during COVID, due to introduction of online education in schools, there was a steep increase in girls dropping out because mobile phone was available to male members more than female members, and for boys education rather than for girls education. We will never be able to capture this data because uh, so many children, they dropped out from school, they got married. Now I have had a ringside view of all this, and therefore I'm speaking more from experience. Next. Now we look at CBRN enabled threats, gender issues. Next. The potential use of chemical, biological, radiological, and nuclear materials by state and non-state actors, of which we have had a lot of emphasis in our course, remains a central and evolving threat. For readiness and to support national resilience against CBRN threats, there's a need to recognize and respond appropriately to gender-based differences in requirements of equipment. We have only talked, all the images that come is only of males and male equipment and what is worn by men. But what if we had women there? What would happen? Do we have, that's a basic question, but if they come in, what would be the equipments required? What would be the women specific or women comfort giving equipments or outfits that they would have to use? Medical management, protection, as well as training and care, all these areas of CBRN. Societal resilience and responses to CBRN threats are further affected by public risk perception. Mr. Jaykumar was constantly speaking about the inability of the people to predict exactly what's happening. What's the fact? What's the situation? They don't know. So the risk perception will generally be affected because of that. And communication, which are influenced by gender, educational attainments, culture, values, attitudes, social organization, some of which we have covered in the earlier slides. The CBRN threats combined with hostile techniques such as the use of hybrid threats and misinformation can also be targeted by gender. We are in the war world now, and we need to be prepared on this front also. Next.
Madam, may I request you?
Yeah, if I have to stop.
No, please don't stop. We'll give we have to take care of other speakers also. So may I request you to conclude in, let us say, 5 minutes time? I think you have got how many PPTs now?
Yeah. No, I have.
Okay.
No, yeah, I can stop. It's okay. You can go through the presentation. It's not okay.
No. It's very, very interesting. I mean, I can tell you have done very hard work, lot of research and lot of information for the participants. But other speakers are also in the line, and we have to close positively by 4 o'clock because there is another program.
I might.
So you kindly take formally conclude after 5 minutes. Yeah. Thank you, madam.
Yeah, I finish 2-3 minutes. There is a lack of gender representation among CBRN first responders and lack of gender-sensitive response guidance. And this can have a negative impact on the ability to provide timely care for vulnerable populations. Now, we hardly see, we have rapid action force of women in the CRPF, but we do not really see them so much as among first responders in the CBRN disasters. And institutions, scientific institutions, like whatever we have in the country, do not have gender representation, even as officers or members of the staff of these institutions, every scientific institution, because of lesser people coming into STEM, and that's a big issue by itself. Social that we have said in the CBR. No, next one. Next. Now, I won't go into Ebola. Ebola has a high potential to be weaponized. The heightened risks in women contracting Ebola due to social roles as frontline healthcare workers I've already emphasized, but I brought in Ebola into the picture now. Now, next. So, what are the gender dimensions and what are the policy implications now for us? Is women's vulnerability disasters is highlighted. Their role in fostering a culture of resilience and their active contribution to building disaster resilience has been overlooked and not been adequately recognized. Marginalized in the development of DRR policy and decision-making processes, and their voices go unheard. They are institutionally marginalized, and I strongly highlight the scientific institutions also. And they continue to be an add-on aspect rather than an integral component of any disaster management, disaster risk reduction program. Accounting for gender and differing needs of the entire population gives a more stable environment for all. I have just 2 more slides, I think. Let me quickly run through. Therefore, what if we assume that CRBN disaster risk is gender neutral, then it's a myth. And therefore, the basic thing of mainstreaming gender is first to look at when you do risk identification and risk assessment, to look at the gender issues. That's the entry point. There are others: inappropriate policy response and financing of risk at national community levels. And I think it was in the 2019 NDMP that we talked about these socially neglected, marginalized groups for the first time. NDMA brought that into the picture. From when I read the slides, is what I understand. Gender risk identification assessment will result in more efficient and cost-effective DRR interventions. Next. So we are looking at mainstreaming in disaster recovery institutions, identifying gender-specific recovery needs, engaging women in recovery initiatives, facilitating a gender-balanced economic recovery. We are not looking at the sociological vulnerabilities resulting in impact on women post-disaster. So we look at gender-balanced economic recovery, institutionalizing gender perspectives in financial assistance stages. I'll quick role of women. I think we'll skip that, and I'll just go to the last slide, and then we close it here. July 23, the NATO hosted. Next slide, please. Next slide, and the next slide. Quickly to the last slide, please. Next slide, please. Next slide, please. Yes, they hosted the 12th deep dive session focused on CBR and defense and gender perspective. And they discussed how CBR and threats affect men and women, boys and girls differently, while highlighting how NATO is considering the gender perspective in force protection and protection of civilians to increase military readiness and support national resilience against CBR and threats. It is now recognized that gender is strategically important trend where our understanding is incomplete alongside of emerging and disruptive technologies and climate change. The need is to build understanding to strengthen and maintain CBR and defense capabilities and integrate them into the deterrence and defense. Thank you. So I'm through with my presentation.
Thank you very much, madam. May I request Dr. Jay, Professor Nimans, Dr. Jay, Professor Nimans, for your observations or comments. Dr. Jay, are you able to hear me?
Speaker so. Can you hear me?
Yeah, Jay, please.
Okay. Good evening to all of you there, and thank you very much for this time. And Madam, presentation was excellent. very elaborate coverage of important aspects of women in disasters and CBRN. I mean, my observations are very, very straight. I mean, she started off with one striking observation about the gender representation in CBR and disaster management. Madam, I was 2 weeks back. I was in one CBR and training by Government of India, and I found the same thing actually, that all the 35 were men. So it actually, it is happening actually, that everywhere it is happening. And of course, this inclusiveness will come over a period of a time, and the representation is the one important aspect, and inclusion, you brought it, and also the health aspects which you covered elaborately, about, especially about the reproductive and mental health aspects of women, and the cultural and social and traditional roles, which actually, how this actually backfires on the women in such an emergency situation, is you vividly actually covered everything so nicely. And I think the want of time actually, that you could not actually complete the other aspects. I think actually that you have given a much needed impetus for this CBR and disaster management to include women in I mean, emergency response, preparedness, or mitigation, and this one. So herein actually, that I think this presentation and the coming days of HBNI programs will also include women as a part of health, as well as mental health, and as well as the overall program of intervention, so that we can be more inclusive, and because this is a one in a population which is actually going to have, irrespective of age, will have actually more issues at different levels, whether it is physical, psychological, social, economic, and other sort of this one. And rightly also, you pointed out the first responders also. I used to see some of the women actually who used to attend CBRN trainings, but not often. So the inclusivity is not only for the survivors or the community, and also for the responders. You rightly pointed out. And with this, actually, that I congratulate and compliment for your up-to-date detail about these things. And yours is not actually sort of a lecture, I mean, a seminar, but you have actually you presented like a faculty actually there. So I was just listening like to another faculty there. Thank you very much for this, and thank you very much for Mishra sir for this opportunity.
Dr. Jay, thank you very much. I think you are extremely busy person in IMAMS, but you are doing, I would say, the real justice, because of your presence. The course has gone a few notches up, and I request Dr. Nand Kumar sir to give his comments.
Good afternoon, madam. It was a very interesting, valuable presentation. Instead of calling it a presentation, I should say that it had so much information that it should have been an invited lecture, a full-fledged invited lecture. It's so much information in it. That's my first comment. My second and last comment is that as far as the response workers are concerned, the response workers are informed about how women workers should take care of themselves so that they don't receive more than the permissible dose, more than the dose limit. However, for members of the public, there is no such limitation. So that's where you made a very valuable point. You've thrown new light on it, and that calls for educating the public. When I say educating the public, I mean educating the women about what care they must take of themselves, and educating the men what care they must take of their women. It's actually two-dimensional care. This kind of education should be important to the public. And I compliment you on this very valuable, interesting lecture. Thank you.
My
Thank you
request,
very much. I think
just make a quick point. My thank you so much for having me here and listening to this presentation, giving your time. I just want that in the next course, HBNI will include one topic of this, We know that there is a lot of research because of COVID. We have a lot of research available on gender issues in biological. But what we do not have, and because of Bhopal, some research emerged. But for nuclear and radiological, we have absolutely no idea what's happening there. We are only giving the broad brush. So I would suggest that scientific institutions such as yours and others, allied institutions, should look at gender issues and see how you're integrating it. And HBNI should be taking the lead in, if you're dealing with CBRN as a whole. No other institution is doing it. You are that unique institution. And therefore, you have the added responsibility of mainstreaming gender into CBRN and feeding it into the NDMA or implementing or policy making authorities. Thank you.
Thank you very much. We move on to the next speaker, Mr. Sameer Mullah. Can you switch on your camera, please? Mr. Sameer, yeah, thank you. So last time we had some difficulty in connecting. Now this is, I think, very smooth going. Yeah. Mr. Sameer, please start with the presentation, and I request you, because we have run out of time. So if you could get help, if you can close in by 3:55 time wise, because we have to close and another session is to start. Thank you. Please.
Samim, your voice is not clear.
Mr. Sameer, there is a problem. You are not audible.
Samim, your voice is not clear. No voice clear. Hello, Samim.
Don't go that side.
Hello. Samim, your voice is not coming.
Now, is it okay?
Yeah, clear.
So-
And make it
sorry.
full screen. Make it full screen.
Okay. Sorry. Good afternoon, everybody. I'm going to talk about the preparedness against radiological emergency in India. First, I'll talk about what is nuclear or radiological emergency. It's any radiation incident resulting or having a potential to result in exposure to and contamination of workers of the public or the public in excess of the respective permissible limits can be termed as nuclear or radiological emergency. In case of nuclear emergency, nuclear emergency can arise in a situation in which there is or presumed to be a hazard due to release of energy along with the radiation from nuclear chain reaction or from the decay of products of chain reaction. This covers accidents in nuclear reactors, like criticality situation in fuel cycle facilities, nuclear explosion. And one of such nuclear emergency example is Fukushima Daiichi nuclear disaster in 2011. And radiological emergency, all other emergency situations which have the potential hazard of radiation exposure due to decay of radioisotopes are classified as radiological emergencies. Example of such emergencies are accidents that took place in Goiânia in Brazil in 1987. And where an unsecured radiotherapy source was stolen from an abandoned hospital site in the city, and it was subsequently handled by many people, resulting in 4 deaths, and about 1 lakh people are examined for radioactive contamination, and about 249 people are found to have been contaminated. So how a radiological accident may happen? So all predominantly these events could have potential to occur anywhere, including locations in the public domain. The potential of radiological emergency could be marginally higher due to wider application of radiation technology in everywhere nowadays. And the radiological events could originate due to failure of inbuilt safety systems at radiation facilities, and events due to loss of a high active radiation source and spillages of radioactivity or other malicious attempts to disperse radioactivity in some undesired locations, which may lead to wide area contamination and release of large amount of radioactivity in the public domain. Such radiological emergencies are low consequences events, but which may not lead to acute fatal exposures to public or workers, but it has the cost of remediation in such cases is very high due to generation of huge amount of low active wastes. In India, the national regulator AERB mandates the incorporation of prevention, preparedness, and response to radiological emergency prior to the commissioning of any approved radiation technology facility. And the prevention and preparedness for radiation emergency is assumed to be having greater significance than response, which is a post-event mitigative measure. So, beside this, weighted guidelines, there needs to be a clear weighted guidelines documents and standard operating procedure is required for management of radiation emergency and response action. Radiological emergencies in public domain can be characterized by several features, like the type of sources involved, type of source, whether it is a sealed source or it's unsealed source, or source category, whether it's a norm or T-norm or any artificial radionuclide, the strength of source, because radiological impact of an emergency is evaluated in terms of amount of radioactivity involved, or source term, and the owners of the source, whether it's a government agency or it's a private agency or any individual. Then an individual can they can produce the radioactive material in case of only illegal occupation, or the whatever radionuclides are involved in the emergency scenario, the dispersion characteristics of radionuclide, that also important factor. The dispersion medium could be air, water, or both. Like some of the volatile radioactive materials are iodine-131, cesium-137, and some of the easily dispersible radioisotopes are radium chlorides and oxides of americium, plutonium, and californium. Therefore, this separate standard operating procedures or situation-specific standard procedures are very much important. The main objective of radiological emergency response are two, the primary objectives. One, first is the reduce the radiation-induced deterministic effect, and another is the limit to the extent practicable the occurrence of stochastic effect. Like examples of stochastic effects are cancer heredity effects, and examples of deterministic effects are acute radiation syndromes and sterility. There are few examples where this radiological emergency scenario can occur. That while the accident of carriers which carrying radioactive material, or theft of radiation source, irregular disposal, abandonment of radioactive source, fire in building which houses radioactive source, or flooding of buildings housing radioactive source, radiological dispersers, detonation of radiological RDD devices, radioactive contamination of water body, and interdiction of orphan sources or norms at any ports or airports or seaports. The response agencies, there are three-tier response agencies are presently working in our country. There's a national level DAE Crisis Management Group.
Mr. Samir,
Yes, sir.
I think very, very interesting, and my full compliments to you. You have entered into a field which is very challenging for a person who has not worked in the nuclear industry. But we have slight time pressure. So can I request you to complete in 1 or 2 minutes, like, because the next professor who is starting the program at 4 o'clock, they have already come. So may I request you to conclude it in 1 or 2 minutes time? Thank you.
Okay. Disconnected.
Am I audible, sir?
Yeah.
Please.
Yeah.
Go ahead.
Yeah.
Go ahead, I would request conclude.
Yes, sir. And
Thank
local level, the first responders are basically police or NDRF personnel, and unit level, Director HSCG Health Safety Environment Group BRC has a responsibility of the national level radiation emergency response director. And beside this, on emergency radiation emergency response manager, who is the head EPRS RSSD, and the officer in charge of a concerned DAE Radiation Emergency Response Center. But currently 25 Radiation Emergency Response Center are present in the country. It is located throughout the country. So this this communication system is very important in case of radiological emergency. This DAE Emergency Control Room is the nodal contact point for any radiological emergency within the country. After receiving any information at the emergency control room, on this they have the protocol is to activate the nearest radiation emergency response center. Either if the any incident or accident information is directly coming to the emergency response radiation emergency response center or DAE emergency response coordinator, so they will have to inform the DAE emergency control room, and they will pass the information to emergency response manager, emergency response director, and for further assistance or guidance. This DAE emergency control room, they will also consult with the national or state level authorities or regulators like ARB, NDMA or SDMA. This next.
What I suggest is you PPTs, if you permit, we will share with all the participants. And if we get an opportunity, we will have another discussion on this. But I'm so sorry. because of the time pressure,
Yes, sir.
we have to formally close it now. So I request today's our senior most faculty, Dr. Anand Kumar, to do his closing remarks.
Good afternoon, Mr. Omim. Your
Yes, sir.
presentation was very good and you have gone to great depths. Particularly interesting was your slide number 4, where you had completely packaged all sources of radiological emergencies and nuclear emergency. That's a wonderful table. I think we will make use of it.
Yes, sir.
Right. And then in this table, I'll only say that we are concentrating on all the elements on the right hand side, except norm and T and norm, for 2 reasons. Number one, they do not pose any serious hazard and they do not call for any extensive response action. And secondly, they are vast, volume wise, magnitude wise. At the moment, they are not managed. Otherwise, this is absolutely a wonderful compilation of all possible emergency situations and the responses. I compliment you on it today.
Thank you, sir.
So thank you very much to all the very, very eminent experts, faculty members, and the participants. It was, I don't know, everybody has picked up some points, but I have picked a lot of points from today's seminar lectures. So thank you very much. I have a few announcements to make on behalf of HBNI. Our board director has conveyed to make a few announcements. First thing is we have an invited talk on 8th Monday, usual time. You will all have one email posters also in this. That will be by our ex former chairman, AEC, Dr. K. Vyas. Very important topic and is a very high profile speaker. Then you all know this is a hot season for all of the India. All the students are busy preparing for their exams. So we have exams on 10th, that is on Wednesday. The details will be shared with you, but we are ready for the exam. Hope you are also ready. And this will be 10 marks, 100 marks exam. The other details are moved to you or will be shared
Email.
on email. Okay. And today we are formally closing. All the faculty members coming together will not happen again. So I would say the Pathshala of disaster management is almost coming to an end, but for the invited talk by our very eminent speaker. So all my best wishes to you for your examination, and please do let us know if you have any questions, any doubts or any points. You can contact help desk or you can contact any one of us through HBNI. We'll be very happy to interact. These are the subjects. All of you have high passion. We will also try to pick up some points from you. So thank you very much. If you have any point right now, flag it. Otherwise, we say bye-bye to you and take care. Okay, sir.